Hello everyone, welcome to Nurses.not.Doctors, where we break down complicated medical concepts and make them make sense, especially for nursing school and real-life patient care. Today we're talking about something that shows up in exams, NCLEX questions, and almost every major blood pressure situation you'll see in clinicals, the renin-angiotensin-aldosterone system, also known as Raas. Let's make it simple, let's make it visual, and let's make sure you never forget it again. So what even is Raas? Raas stands for renin-angiotensin-aldosterone system. Think of it like a hormone domino effect. It raises blood pressure, it increases blood volume, and it makes sure your vital organs, like the brain, heart, and kidneys, stay perfused. Raas is not just a random hormone floating around, it's a controlled system that starts in the kidneys, travels through the bloodstream, and changes how the blood vessels and kidneys behave. The big takeaway is that Raas is the survival system when perfusion is threatened. Why is Raas even important? Raas is literally the reason people survive shock situations. Its job is to make sure blood pressure stays high enough to push blood to the brain, the heart, and the kidneys. Without Raas, even mild loss could cause organ failure. This is why patients with shock, dehydration, bleeding, or severe vomiting rely heavily on this system. Clinically, this matters because when Raas works too aggressively, we get hypertension and fluid overload, and when Raas fails, patients can lose perfusion to vital organs. What causes blood pressure and blood volume to drop? Raas activates when the body senses three major signs of danger. The first sign is fluid or blood loss. Some examples of this is vomiting, diarrhea, dehydration, and diuretics. Less fluid leads to lower blood pressure, so Raas jumps in. The second major sign is low cardiac output. An example of this is heart failure. If the heart can't pump efficiently, the kidneys think pressure is low, which leads to Raas activating to try and compensate. The third major sign is vasodilation, and some examples are sepsis, anaphylaxis, and neurogenic shock. When the blood vessels are too wide, pressure drops, and the Raas tries to tighten them back up. So let's get into the first step of the Raas system, and that would be the release of renin. Everything starts in the kidneys. When the kidneys sense low blood pressure and low blood volume, they respond by releasing renin into the bloodstream. Renin is not the fixer. Renin is simply the starting hormone that sets off the Raas system. The second step is converting renin into angiotensin 1. This step starts with the liver. The liver is constantly producing a protein called angiotensinogen. Renin will go and find angiotensinogen, bind to it, and it turns it into angiotensin 1. Angiotensin 1 is still pretty weak. Think of angiotensin 1 as a baby hormone. It exists, but it can't really do much yet in the body. The third step of this system is converting angiotensin 1 to angiotensin 2. This process starts with the lungs. The lungs produce ACE, which stands for angiotensin-converting enzyme. ACE converts angiotensin 1 into angiotensin 2. Now this is the powerful one. Angiotensin 2 is a strong hormone that actually does the work for the Raas system. It causes strong vasoconstriction, leading to tighter vessels, which increases blood pressure and signals the adrenal glands to release aldosterone, which increases blood volume. The fourth step is the actual effects of angiotensin 2. Angiotensin 2 does two huge things. The first thing is vasoconstriction, which tightens the blood vessels and raises blood pressure immediately. The second thing it does is it triggers aldosterone release from the adrenal glands, and aldosterone tells the kidneys to increase blood volume. Okay, now let's pull every step together so we never forget how the Raas system works. Renin is released from the kidneys when low blood volume is sensed. Renin travels through the body and binds to angiotensinogen, which is produced by the liver. When renin and angiotensinogen combine, they create angiotensin 1. Angiotensin 1 then travels to the lungs and binds to ACE. When angiotensin 1 and ACE combined, they form angiotensin 2, which increases blood pressure and blood volume. And that's the Raas system, explained in a simple way nurses actually need to learn because we are not doctors. If this helped you understand it better, hit like, subscribe, and share it with your classmates so no one has to struggle with Raas again. This is Nurses, Not Doctors, where we learn smarter, not harder. See you guys in the next one.